have got some wonderful speakers that are going to talk to us about different facets of One Health and linking that to food systems. We have Dr. Jo Swinen, who is the Director General of the International Food Policy Institute and also the Global Directors for Systems Transformation. Please welcome, and he will talk to us about food systems. Thank you. And then the other speaker that we have is Dr. Martin van Nieuwkoop. I hope I've said that right. Who's the Global Director, Agriculture and Food Global Practice at the World Bank. And he focuses on One Health, linking global trends with and regional actions also in Africa. And he's focused primarily on East and Southern Africa. Martin, welcome. And then taking us into a country perspective, we have Dr. Salum Manyata, Prime Minister's Office, focusing on One Health in the government of Tanzania. Dr. Salum, welcome. I'm going to ask two more panelists to actually join, and I want them to listen to what the others will say so that they can reflect upon the conversation. And this will be Dr. Ian Wright. He is Deputy Director General of Integrated Sciences at the International Livestock Research Institute. Dr. Ian, please, if you can join the group. And lastly, certainly not least, I would like to call Dr. Lysiane Lefebvre, Policy Advisor and Project Manager at Shamba Center, bringing to us a perspective of what NGOs are doing to try and address issues on One Health. Welcome to you all. One Health is a challenge. We are told about 1.2 million deaths from One Health related issues now, from AMR in particular, but we are expecting that to go up to 10 million by 2050. So we do have a problem. Can you give us an indication of what the issues are in terms of food systems transformation and what perhaps you feel we need to look out for in terms of One Health?
Thank you. Thank you for inviting me for this session. Can you hear me? I'm not sure of the microphone. Okay, great. So I was asked to say a little bit more, and your question as well a bit about the broader issue of food systems transformation. I think the food systems transformation looks at problems from a perspective that many things are depending on each other or interacting. So as I was initially trained as an agricultural scientist and later as an economist, for example, in economics we use models where we have consumers, producers, and taxpayers often, if there's like subsidies to be given or something. And that is a very useful model to look at a lot of problems in the world, but of course it ignores a lot of other things that are happening in the world. So there's not much explicit attention immediately if we think about quantity of food to the quality of the food, and so this quality obviously is extremely important when you think about health. The externalities can be brought in, but that makes it more complex. I think system transformation takes explicitly a much more broader approach. So it looks at biophysical components, institutional components, economic, social components, environmental components. And for example, if you look at the website of the CFS or the FAO, they have these very complicated models. I was going to put some of them up here. And so they look, but when you look at it from an analytical perspective, it looks like a spaghetti ball, right? So it becomes very complicated to use in terms of, if we want to think, for example, how we want to steer the system in a certain way, that means you need to change some things. for example, subsidize something, invest in other things, prohibit other things, and then how is this going to affect the outcome? So the more complicated the system is, the more difficult it is to make these predictions, the more difficult it is to steer policies in a sort of system in a certain way through policies. Like in economics, the typical thing you learn almost in your first class of public policy is that if you have two objectives, you need two policies, okay? One policy for each objectives. Now here explicitly we're looking at multiple objectives. We're looking at, and this is food system transformation, for example, we're looking at poverty reduction, improving nutrition, so reducing malnutrition, climate change objectives, biodiversity objectives, etc. Okay. Now these policies through the system will interact with each other, and so they may reinforce each other, or there may be trade-offs there. And so it becomes a very, very complicated puzzle to deal with both from an analytical perspective, but certainly also from a policy perspective. And so these things are really central to a food systems perspective on the issues that we are facing today, the challenges and the opportunities, of course, as well. I sometimes use a kind of a simplified version, even if only in my mind, to keep things a bit practical. One is look at the vertical dimension, which is really along the value chain, not just the producers and the consumers, all the actors in between and after and before, to have a better perspective. And then what I call the horizontal dimension, which are these multiple objectives that we deal with. Now, if we link that to One Health, in a way you can almost argue, or I think one could argue, that One Health is almost an application to a specific issue, a very broad issue in itself even, of this food systems perspective on the world and the transformation issues. And they are also obviously the issues of how to address particular issues with certain policies, and how that interacts with these other things comes to the very much to the forefront, I think. For example, a very important recent study by Chris Barrett, it's led by Chris Barrett out of Cornell University. There was a whole bunch of people involved. I think, Namukolo, you may even have been involved, on the on basically bundling of policies, where they said, you know, you need a number of policies that you have to address. So even if you invest in technology, but nobody is using your technology because there are credit constraints, for example, you have to address these as well. And by putting package of policies together, you may have a bigger impact. But still, there may be trade-offs as well in this process, and so these are things. So I think the One Health perspective and the food systems transformation perspective is extremely important for Africa in itself already, but of course now with climate change, I mean, climate change has all kinds of implications, I think, for the One Health issues. It affects it in a variety of ways. I think we'll come back to that. I don't need to go into details here, but it's an extremely important way of looking at these points. So why don't I stop here, and I'll be happy to, we may come back to specific issues later on in the discussion.
Thank you very much. Dr. Martin, World Bank, you've been working a lot on trying to figure out, doing some analyses on One Health. Can you give us some perspectives based on your experiences on One Health, linking it to food systems?
Well, thank you very much. And definitely, I can provide a perspective, also a personal perspective, and I will bring that in as well. But to start off, I mean, clearly, if you look at the pandemics that the world has faced over the last 25 years, about 70% of those pandemics were pandemics of zoonotic nature. So, and therefore One Health, to respond, I mean, to the root causes of those pandemics and be better prepared, is a kind of a no-brainer. And we've done, I mean, being at the World Bank, you know, we provided a kind of an economic perspective on One Health. And the economic case actually for One Health is very, very compelling, with rates of returns up to 86%. We did a recent report that came out in 2022, that is that the cost of prevention using One Health principles, cost of preventing pandemics moving forward, is about $10.3 to $11.5 billion per year. And of course, I mean, that is actually less than 1% of the cost that it took to respond, I mean, to the impact of a pandemic, using COVID-19 as a reference. So we're in a situation, I mean, that the food system actually is associated with the root causes of the pandemics that the world has been facing. Now, despite this very compelling economic case, there's actually very little resources going into One Health. It's actually very much underfunded. So the question then is, why is that? So we also looked into that. I mean, first of all, ministers, senior policy decision makers are very reluctant to invest in prevention in the first place. I mean, not necessarily on health. It happens everywhere, because actually, from a political perspective, it's not very attractive. No, it's very difficult to prove that you prevented a crisis by investing in prevention, while at the same time, if you invest in prevention and there is a crisis, that everybody will be looking at the minister and say, hey, I thought you were investing in prevention, why do we have this crisis? So basically the downside risk is much higher than the upside reward, no? So that's one. The other thing is that, that trade-off between investing in pandemic risk reduction and the economic benefits associated, with the various economic activities in the sectors of agriculture and food and resource extraction. So that trade-offs, so that also come to play. And thirdly, in the end, a pandemic risk anywhere is a pandemic risk everywhere. So clearly it's a global public good. And of course we know from economics, I mean, that, global public goods is a kind of a global common. There's always a free riding attitude, so there's always underinvestments in that. So clearly there's a cycle of panic and neglect at work. So what needs to happen to break through this cycle of panic and neglect? We see actions that need to happen both at the national level and at the global level. Now, if we talk about the national level, and it also includes for Africa, the first bucket would be that there are conditioning factors in place for a more systematic One Health, and those related to policies, capacities, compliance, and the like. I mean, very often that's very much missing. The second bucket relates to the more effective implementation of One Health efforts, and this is of course very much a multi-sectoral approach, so you need effective multi-sectoral coordination. It brings together animal health, human health, environmental health, so we need a whole of portfolio approach. The state, the public sector needs to collaborate with non-state actors, private sector, etc., etc. And the third bucket, we need shifts to catalyze and make sure that we have more sustained financing for One Health solutions. So we need to be able, given that this is a multi-sectoral activity, most governments wouldn't even know how much they're spending on One Health. So basically what we need, and it's also one of the recommendations coming out of the latest report that we did last year, we need a One Health lens on the budget, the public budget, so that the various ministers, agriculture, health, environment, actually know to what extent they're contributing to the One Health agenda, so that you can come up with a consistent approach. Now, when it comes to the global community, we need to actually have a very clear idea about the gaps that exist at the country level, so that the global community can actually play a role there to filling those gaps. Because what you see is that if you look at the pandemic hotspots, many of those pandemic hotspots are actually in countries that are relatively poor, and you cannot expect actually that from the national budget, I mean, they cover those costs. The other one is, of course, the multi-sectoral coordination I already mentioned, and most importantly, given the global public goods nature, we need more sustained financing of One Health. So that means off-the-top financing, so not basically donors responding to country demands, because that will lead, I mean, to the cycle of panic and neglect. And here comes my personal experience in. I was based in India 2005 to 2007 when we had a global outbreak of avian influenza. And the response that we did was actually putting in place a One Health project. Where actually for the first time, we started working agriculture and health and put together actually quite an effective One Health project that was recognized. But there was no kind of follow-up. I moved to another position in the World Bank in Africa, working on Nigeria. We're equally, in response to avian influenza, we had a very effective
kind of follow up quickly on something that you said. The experience you are sharing from India, you said your response was to put in place a One Health project.
Yeah.
Do you think there was better reception to that project because there was just a crisis, or?
I will come to that actually. It's a very interesting question actually. So I was talking about Nigeria. So the same thing happened there. So we had a very effective One Health project. The question was, are we going to do a follow-up? And then the question was, okay, should we invest in education or another One Health project? And in the end, it was decided to go for education. Same happened in India. Now the interesting thing is that when COVID hit, I think there was some muscle memory, in India, where the agriculture ministry and the health ministries actually worked together, because very quickly India came up with a request, for a One Health project. So if you look at what the bank is doing in response and supporting, our countries, responding to COVID-19, what the bank is doing, we're putting in place quite a few One Health projects, but India was actually the first one to come forward, with a request for a One Health project, when COVID-19 was still, it's still not finished, but when COVID-19 was still at its height. So that in response to your question. So I think we planted the seeds, muscle memory, and now we have another One Health project there. Now, what's the bank doing overall? And I will conclude with that. So we've done the analytics, we contributed, we do global advocacy. This is a global public good. To pay attention, to this very important topic, also given the very high attractive economic rewards. In IDA 20, which is the soft loan arm of the World Bank, every 3 years that's being replenished, and a number of policy commitments come along with those replenishments. So in the current IDA 20 cycle that we have, we put forward, and I actively engaged on that, an IDA 20 policy commitment for One Health, and it actually means that we have a corporate commitment to mainstream One Health approaches in at least 20 IDA countries. Even more important, the bank was very conducive in helping establish, the pandemic fund. It was established last year. That provide off-the-top financing for One Health. We mobilized up until now $2 billion, and they did the first round of allocations to countries, including quite a few African countries. So I think.
Very important. I'm interrupting you now because I'm going to come back to you with another question on investment in countries. But let's now hear from a government situation from Dr. Manyatta. You are part of a government machinery trying to figure out this One Health perspective. Can you give us an idea of what the Tanzanian government is doing to try and bring One Health into action, if you will? Over to you.
Thank you. As my colleague have just said, One Health has an integrated unifying approach, which is aimed at sustainably balance and optimize the health of the people, animals, and the ecosystem. In Tanzania, the One Health section is positioned at the Disaster Management Division at the Prime Minister's office. We are strategically positioned because of the Prime Minister's office is also in the Constitution, Section 52, which mandates the coordination of government business. So the section in the Prime Minister's office, so it's a very strategically located to coordinate anything to do with One Health through all the sectors. We have tools. We have the policy, disaster management policy of 2004. We have Disaster Management Act of 2022, which also mandates the One Health approach. We have One Health strategic plan of 2022-2027, and now we have just finalized the implementation guideline, which also will align the use of One Health approach from regional up to the village level. Our role is to lead the cooperation and collaboration between ministries, sectors, and allied institutions to improve the prevention, preparedness, early detection of health risk, and also respond if there is a need for response. But we are also, our role also entails to enable communities through the region, the district, ward, and villages committee to take charges in prevention and control of public health risk. Our framework for disaster, including One Health, is we have committees from the national level, regional, district, ward, and village. So to enhance those committees, our role is also to enhance those committees to practice the One Health approach. We focus on zoonosis. We have evidence that more than 60% of diseases come from animals. So we focus on the zoonosis, and we have prioritized the zoonotic diseases, which include the anthrax, rabies, we have Rift Valley fever, we have trypanosomiasis, and we have hemorrhagic fevers, which we include Ebola, Marburg, and others. But we are also focusing on antimicrobial resistance, food security and nutrition, environmental health, emerging and emerging diseases, which also the COVID-19 fall on that. And now we're also engaging on the non-communicable disease. The non-communicable disease has emerged as a very threat to our country because the prevalence of the non-communicable disease, including diabetes, hypertensive heart disease, and others, and cancer is alarming. We have seen the benefit of this is that we are maintaining an active collaboration and communication between sectors for the active prevention and control of public health risk. And with this, One Health draw expertise from various sectors to reduce the burden of zoonotic disease and other emerging and emerging events, but it's bring about mutual commitment and enhanced collaboration in dealing with health threat. If we are united, then we can control and prevent the pandemic and emerging diseases. We have an ensure there's a good preparedness, consistency, coordination, response when there is any emerging diseases. As we are in coordination in One Health, there's also challenges in our country. One of the challenges we have, there is an inadequate implementation, especially at the subnational level, because of the awareness in each level. We are the coordination at the national level between the sectors. We have focal person. We are doing very well in that regard, the region, but at the ground level, we still some challenges in actual implementation of the One Health concept. There is also a low coverage of surveillance system, because between sectors, each sectors have to have surveillance system, but other sectors are lacking. The health sector is a bit good in the surveillance of diseases. They have the electronic system like IDCR and event-based surveillance, but the other sectors, the livestock, the wildlife, the agriculture, they are lacking some very strengthful surveillance system. with regard to the food transformation, we know that when we have we have diseases like zoonotic diseases, like anthrax, brucellosis. First, they affect the host, which is the cattle, the goats, and the like. And then this leads to low production of even the quality of meat is impaired. So we need to unify the One Health approach so that we have the quality production. Even the pest control, we know that the unuse or the misuse of pests, there's going to be a spillover in the environment, and that will affect the whole system of our ecosystem. And
it sounds like there's a lot that you are doing on One Health. I like the fact that you are going all the way to the subnational level with your implementation processes.
Yeah.
But that makes me want to come back to Martin. You had started talking about investment. One of the challenges that we see, especially in Africa, is that while we are able to meet food safety standards for our export products into Europe and other places, that's not the same for the food in country. So the question that I have for you, because you had started talking about investment, is to what extent are you beginning to see African governments including either food safety or trying to look at infrastructure to address One Health related perspective, perhaps surveillance? Are you seeing that? Has COVID helped us? What does the landscape look like?
Short answer, no. What we see is that in many of our projects focusing on value chains, there is attention to food safety related issues as a compliance issue for export markets, as you mentioned. But I mean, for the domestic markets, we don't see explicit demand for food safety interventions, or even more importantly, working on the whole food safety ecosystems. I mean, the standards, the capacity for enforcement, a risk-based approach, collaboration with the private sector. And we think, I mean, that this is a huge missed opportunity. I think that was also discussed at the Africa Food System Summit. Africa can feed itself. Most of the demand is actually coming from rapidly growing urban centers in Africa. And in order to respond, I mean, to the demand, I mean, so basically the linkage and the relationship that existed between producers and consumers, is getting kind of looser with the rapid urbanization, and that actually means that food safety is becoming more and more important to make sure that farmers actually have access to those rapidly growing markets. The fact that you see imports going up very rapidly to feed and respond to the demand of those growing urban centers. Part of those factors, besides also the logistics, I think is the absence of a well-functioning food safety systems. And so as part of Africa feeding itself and recognizing that moving forward most of the consumers will be in urban areas, food systems food safety systems and then functioning ecosystem is very much part of the puzzle to make that happen. And so I think we think Africa needs to step up investments there, much more so than it is doing now. And if they come forward with demand, and of course also in our dialogues, we actually pointing out what they were just saying, the bank and I'm sure other donors will be very much willing and interested to kind of collaborate on that agenda.
Thank you very much. That has a mind of its own. I think that what Martin has said brings me back to you, Yo. I introduced you as a guru of food systems transformation. You're the global director of systems transformation within the CGIAR. So the challenge that I would like you to address for us now is, Martin says we really need to take a systems approach, which is where you're sitting. In the work that is going on, you talked about very complex systems perspective. Do you see a role within your work to try and bring in this systems approach to get a stronger perspective of One Health into developing processes for development processes for African countries? Are you able to speak to that in terms of where we are now in the CGIAR?
Yeah, thank you. I have no claims of being a guru in this thing. I feel more like somebody who's dragged along to try to manage whatever is happening around me in some way. The short answer, I mean, I'll start like Martin with the short end. The short answer is, if we are not doing it, we should be, okay? And so I think the CGIAR has made a big transformation over the last, I mean, we have a new research strategy developed about actually 2 years ago, the 2030 Research and Impact, Research and Innovation Strategy. And there, the food systems approach, including a lot of the One Health components, are very central, okay? It's really, and I think it's a very different way of looking at the world, of the world, also how research was done within the CGIAR compared to, let's say, 20 years ago, okay? Of course, it's not just that. At that particular time, things changed because before already there were a number of programs in place which were looking at this as a system. But it's certainly very central in terms of what we are doing and want to do even more in the future going forward. And so, for example, I think if I just look at IFPRI, for example, where I know the attention paid to nutrition is something which is much more central to what we do than it was also when IFPRI was created, where the attention was much more in terms of how can we reduce hunger in the sense of how can we get people enough calories to survive, okay? And so that has evolved tremendously. And so the idea that you have to take a much broader perspective on it, it's not just you look at things like school feeding programs are obvious cases where you really address immediately the needs of children who are in need of certain, both in calories and in vitamins and micronutrients, etc. But it's also looking at the whole supply chain of getting there and how you can provide an environment in the sense, the social environment, economic environment, so that the private sector can play a very important role in these things is very central to what we do. And of course then the link to the, I think that I mean, I'm looking forward to Ian's intervention later, because I think it's also been central to what, for example, ILRI has done in the livestock sector, looking at these very different components. So absolutely we are looking at that. I personally have spent a lot of time in my academic or my research life, when I was still a researcher, looking on about the role of standards in food systems and value chains. And so what Martin just talked about, I think is really important going forward. I think more broader in terms of if you think about climate change going forward, the issue of standards, sustainability standards, how they're going to be applied to products, production processes, and then ultimately be translated into standards which come with something, is going to be crucial going forward. But the food safety one has to come almost, I mean, both are very important, okay? And so, but even if you look, I looked the processes in Europe, I know very, very well, because I was there in working with the European Commission when they were introduced, and we did a lot of work on how that was affecting international value chains, affecting farmers in Africa, etc. And so I think it's been quite successful in terms of having impact. But the point, of course, is if that is not translated in Africa into the domestic change, you're only reaching so much of the system, of course. And so I think I fully agree with with Martin. That's a very important investment area. But the point is also, if you invest in it from an institutional perspective, it has a lot of spillover effects on these other things in terms of being applied to things like sustainability standards, which will become important, no doubt, for the future.
That's great, but it really sounds like one of the big gaps that we've got is actually investment. To make sure that we invest in not only the infrastructure associated with maintaining a One Health perspective and surveillance and the like, but that also makes me want to go back to Dr. Manyata, because you talked a lot about some of the systems that are in place in Tanzania, but there's always also the issue of spillovers from across the border countries. You are bordering DRC, for example, and there's been Ebola outbreaks and stuff like that. So the question that I have to you, because as we talk about investments, it's not going to be investments only in food safety systems and the like. It'll be investments also in trying to do better surveillance, managing spillover situations. So the question that I have for you is that, first of all, I'm actually quite impressed with what you said Tanzania is doing, especially the idea of going all the way to the village level. But what are you doing in terms of mitigating risks for spillover events across borders? Is that an area that you are also working on? Over to you.
Yeah, thank you. We have in all point of entry, being it through airports, ports, and loads, we have staff interdisciplinary at the point of entry, and these people are working very close with their counterparts. You find like in Namanga, Kasumuluka, Tunduma, and other POE. Those people are working very close with their colleagues in the neighboring country, and they are sharing surveillance, because they are sharing the surveillance information at that point, and they have a meeting in those neighboring districts. But at the national level, we are doing the cross-border meetings with regard to the surveillance data which we have. We are sharing information for the border with Malawi, Congo, in Kenya, Uganda. So at national we are doing the meeting, but at that point of entry they have a regular meeting sharing surveillance information. But we also have also done some of the simulation exercise cross border, like in Kenya with our neighbor Kenya, we did for Rift Valley fever, we did for Ebola with Uganda. So we are also doing the cross-border simulation with neighboring countries, but sharing data at that cross-border. The district which are bordering the neighbor district, they are sharing information with regard to surveillance. Like for instance, we had our good neighbor Malawi had that cholera, which was almost took over 3 or 6 months, but they were sharing data with the neighboring Ileje and Kiela district, which are very close to the border. That's how we are doing the cross-border surveillance.
Okay, thank you very much. So it's very clear this One Health thing, we need to really look at a more holistic regional perspective as well. I want to ask you a second question and about investment. What type of investment do you think you need to be able to take a holistic One Health approach? And Martin, you be prepared, because I'm going to ask you a question of how do you think African countries should work towards investment, what type of investments, and how might they go about it? So starting with you first, Mr. Manyata, from a country perspective, you talked about a lot of things that Tanzania is doing, is trying to do. Can you speak to the type of investments that you think the country needs to address One Health effectively, of course with a food systems perspective as well?
Thank you. First and foremost important thing is for anything to prosper, we need to invest on people. We need to invest on capacitating the team, the people with regard to One Health in all aspects, in preparedness, in prevention, response, recovery. That's the foremost first thing. So from the national to up to the village level in terms of our structure of administration. But the second thing is on surveillance, we need to invest on laboratory investment with both in animal, wildlife, and human health, because with investment in identifying early warning, identifying and confirming for the diseases, for the emerging diseases is very important, both in wildlife, human and livestock, and also plant health. So the second most important thing will be investing in lab and surveillance. We need to invest on surveillance systems so that we are getting the up-to-date information, real-time data from all sectors, from the wildlife, livestock, human health, and plant health, so that if there's any early warning, then we can act accordingly.
Thank you very much, Martin. You are coming from an institution that is investing in development. So, what type of recommendations would you give? What should we be looking for in terms of investments? And what would you advise a government like Tanzania on how they could perhaps approach that? Not only investment requests from the World Bank and other multilateral investing institutions, but also from government budgets. What would you advise?
Well, I want to come back, to the point of that governments need to know their resources, in the sense that I would expect most governments, are making resources available for animal health, human health, and environmental health, but now very much in a kind of a siloed fashion. So actually, how can we kind of establish connection under the One Health umbrella to make sure, that those expenditures are used in a more effective way? I think that's one. Second, picking up on Joe's point on the spillovers, there are huge economic, co-benefits, associated with investing in One Health. And particularly if you look at the environmental health and the animal health dimensions of One Health, it boils down to good agricultural practices, no? So avoiding expansion of the frontier, agriculture frontier, avoiding deforestation, because that actually will bring animals in contact, with wildlife, and that actually increases zoonotic risk. But if you do that, then there's beneficial effects on biodiversity, reduce deforestation, which is measures in wet markets as part of to avoid transmission. But that it goes hand in hand then with reduced burden of people getting sick from animal foodborne diseases. But also those good agricultural practices will be helpful in accessing markets because, in line with compliance with the standards that those export markets are demanding. So basically, it would be good for if I look at the project that the bank is financing, that in those various sectors, that actually put a kind of a One Health lens, you know, on those activities, so that we can make sure that we include One Health sensitive activities in those projects, so that we capture those spillover effects and those co-benefits that I just mentioned, which is not happening right now. So I think that's also kind of a low-hanging opportunity. Third is, I think, with the establishment of the off-the-top funding, the pandemic fund, I would really urge, I mean, African countries, I mean, to look at opportunities to kind of access those funds. I mean, I think it was in July that the first round of allocations was done, and Burkina Faso, Togo, Cabo Verde, Ethiopia, and Zambia actually are receiving funds from that global pandemic fund. I mean, to start moving on One Health. This is just the first round of allocations, and there will be allocations moving forward. So this is a heads up. Of course, the question is, and that's the final point I want to make, is, you know, if you really want to avoid the notion of panic and neglect that you see often, you know, with One Health, is focusing on the carrots enough, or do you also need a kind of a stick approach? And I think there, the World Health Organization actually is negotiating, I think, moving forward on a kind of a global treaty of pandemic prevention, where I personally think, and this is not a bank opinion, but personally, I think, you know, there should be some stick measures there as well. I mean, countries expect, I mean, that they have access to global markets. The question is, what I said earlier, you know, I mean, a pandemic risk anywhere is a pandemic risk everywhere. So the question then is, in order to be a good neighbor, to what extent should that access to global markets be conditioned into putting in place, I mean, some measures that actually will make sure that all countries are good neighbors. So I think that's a very open question, but I just want to put it on the table, maybe also to stimulate some debate. Thank you.
Well, we've got a lot of researchers in the room, so maybe they will pick it up as a research area to explore issues there. But I'm reluctant to let you go just as yet, because you said something about this pandemic fund. The pandemic fund that you said several countries have been able to access from the World Bank. What type of things are they asking to use the funds on? Do they have to specify, or is it a pocket of money just waiting for a pandemic to happen?
So right now there's a $2 billion have been mobilized for this pandemic fund. So those are contributions from countries, and then the bank is doing the administration and being the trustee of those funds, as well as together with the World Health Organization, the kind of the agencies that actually then provide the secretariat functions, I mean, for this pandemic fund. There's a steering committee consisting of the contributors, I mean, to that fund, as well as representative of potential recipient countries that would ultimately make the allocation decisions. So there's a call for proposals that goes out on a regular basis. The first call just finished and the first allocation is being made. And the thematic focus of those call of proposals might actually shift over time. I think if I remember correctly, this call for proposals was particularly focused on activities that countries can put in place to improve their surveillance systems. And in the allocation proposals, there was a preference for proposals that actually are using the One Health approach, I mean, to strengthen those surveillance systems. So that was the notion of the. So I think there's another call coming out. I mean, later this calendar year. So that offers opportunities. I mean, including to African countries. Yeah.
Yes, I think it offers opportunities for collaborative engagement as well across different
that's actually an important point.
stakeholders.
So there is also a preference for actually regional projects. So in this first round of allocations, there were a number of regions and sub-regions that got allocations. I know, for instance, you know, the countries in Central Asia, they put together a regional proposal. You know, Kazakhstan, Tajikistan, Uzbekistan, etc. And they got also funding. And what I said, you know, given that this is a pandemic risk crosses borders very easily, it actually makes sense to do this in a regional context or sub-regional context, fostering this collaboration so that also countries actually can learn from each other. So,
Okay. Thank you very much. And Lisanne, you've been listening. I'm going now to our panelists who are going to reflect on what has been said. You've been paying attention. I've been watching you, and you've been paying attention. You do a lot of work, you know, as an NGO, directly with people, trying to look at the One Health approach and stuff like that. Based on what you have heard everybody saying, could you perhaps give us an idea of lessons that we need to pay attention to that you've picked up as part of your work? Over to you.
Thank you for the question. So what we've come to realize, namely through developing country roadmaps in Ethiopia, Malawi, Nigeria, Madagascar, and Zambia more recently, is that this One Health approach is really appropriate in the context of so-called food systems. And what we've seen as our work is that the various outcomes sought by this agenda on food systems transformation, from increasing smallholders' incomes to enhancing nutrition to reducing greenhouse gas emissions, that those various outcomes are sometimes made to compete rather than complement one another. And that's partly due to inherent trade-offs that exist in the system. And it's easy to focus, and it's tempting to focus when taking a One Health approach to food systems transformation on the positive synergies in the system. And there are, of course, important contributions that healthier diets, for example, can make in terms of reducing the risk and the severity of non-communicable diseases. But there are also trade-offs that we need to consider when looking at the interlinkages between human, animal, and environmental well-being. And so, for example, how do we promote healthier diets while ensuring affordability for populations with limited resources? What about reducing greenhouse gas emissions when there's high demand for animal proteins? So we've also seen examples of trade-offs between the short and the longer-term priorities, where short-term policies conflicted with longer-term objectives, and on the reverse, where longer-term policies just didn't make sense or didn't work in the short term. And so, for example, most countries with which we've worked focus on increasing yields for staple crops like maize to address food security in the immediate term. But that isn't necessarily coherent with these same countries' longer-term policies promoting nutrition-rich crops as a way to combat malnutrition. And so the solution we found in this case is to encourage crop diversification in the short term while supporting sustainable agricultural practices in the longer term, thereby reinforcing food security while setting the stage for lasting nutritional improvements. And so such trade-offs need to be part of the larger conversation and the larger thinking around One Health and sustainable food systems. And then another key reason why outcomes are often made to compete rather than complement one another is that those different outcomes are often the remit of different ministries. So for example, ministries of agriculture would generally look at boosting productivity, which sometimes can come at the expense of the environment. So we've had to start bridging those incoherencies by promoting interministerial coordination. And so in Malawi, that's resulted in the Ministry of Health's nutrition guideline adopting a more holistic approach and being developed in close collaboration with the Ministries of Agriculture and the Environment, in recognition that nutrition is not solely about individual dietary choices, but that it's really intertwined with the quality of our food supply and the sustainability of our agricultural and environmental practices. So it is very encouraging to hear from Tanzania right here that they're adopting this One Health approach and that they're really making this conscious effort to drive more policy coherence through that lens. And so our key takeaway here is that adopting this One Health approach is really essential to the food systems thinking that we need in order to achieve sustainable transformation of food systems. But that requires more coordination at national level within government agencies, between different levels within the national environment, but also between the government and other stakeholders, and between national and international levels. And that also requires careful balancing and thoughtful consideration of existing trade-offs in the system. So that's why we support a call for more political alignment, more policy coherence that translates into coordinated interventions across development outcomes, across ministerial agendas, and across different timelines. But what we're also realizing is that something we've yet to fully explore, and definitely something for us to take up on our upcoming work, is that there's also a need for such coordination to be improved between different types of stakeholders and at different levels. So we need to integrate more and promote more coordination between government agencies, but especially between government agencies and other stakeholders, from the private sector to academia to civil society, and between those stakeholders at the national level for more coherence with regional and international frameworks.
Thank you so much. I think that gives us a lot to actually think about in terms of how we can, the types of collaborations even that we might need. Ian, you've also been listening for some time. And one of the things that I would like you perhaps to reflect on is, I'm aware that there's work that's been done, led by Ilri, working with the African Union to try and bring in the issue of food safety for informal food markets that we normally overlook. We still get about 70% of our fresh food from informal markets. And the idea of developing guidelines, food safety guidelines for informal markets is really quite impressive. So based on what you have heard others say, can you perhaps reflect on what we should pay attention, what the different food safety, One Health practitioners, researchers, whoever is in this room, what should they pay attention to with respect to One Health?
Thanks. Thanks, Namakolo. Yes, I've been interested in listening to the discussion with a lot of interest. And yeah, I might highlight one or two points, some of which have been made by the panelists, and one or two perhaps which have not been mentioned. I think the first is this issue that we've heard a lot about, is the fact that, you know, if in food safety or the other One Health challenges that we face, they are multi-sectoral, they're multi-institutional. So effective coordination, policy coherence, and so on is critical, and I think all the speakers have alluded to that. Okay, let me move it. Is that better? Yeah, okay. So this issue of institutional coordination and coherence is absolutely critical across public sector, across ministries, but also involving the other stakeholders, private sector, civil society, and so on. And I think we've had a good example this morning from Tanzania as to how there's a One Health unit that sits within the Prime Minister's office. And I think that if the coordination is going to be effective, it has to sit within a Prime Minister's office or a presidential office and have the political will and the political leadership behind it. So those structures and mechanisms for coordination and coherence are critical. Second point I would like to highlight is the lack of data. We have estimates, for example, of the incidence of foodborne diseases and the impact, including the economic impact at kind of global and regional level. But when you come down to the country level, there's a real lack of data on the impact of food safety. And as they say, if you can't measure it, you can't manage it. So there has to be investment in measuring the impact of foodborne diseases and so on. Otherwise, we're not going to be able to make progress. We won't know where to invest and how to invest. And as you point out, Namakolo, there's a mismatch between where the investment is going and where people actually purchase their food. 70–80% of all fresh foods are sold and traded in informal markets in most low and middle income countries, but 80% of the investment goes to the formal sector. Now, Martin's explained why that happens, because governments are often interested in the export market, so they invest in the formal sector to try and access those export markets. But the reality is the domestic markets, and in particular the informal sector, are being ignored. But yet, that's where 70–80% of food comes from. So there's a mismatch in terms of the reality of where food is traded and where the investment in food safety is going, and that needs to be addressed. Fourth point I would make is the issue of resources. And when I talk about resources, I'm going beyond investment. We've heard a lot about the need for more investment and where that investment should be. But we need a lot more capacity, both human capacity and institutional capacity, in the One Health space. And that has to start in the education system. You know, in medical school or vet school, One Health doesn't normally feature in the curriculum. But now we, with funding from the European Union, are working with a number of countries, including Ethiopia, to get more One Health into the curriculum of university courses, medics and vets and so on. Because if we don't do that, we will not have the human capacity to be able to adopt the sort of approaches that we're talking about this morning. And then the final point I want to make, which I think is really important, is the issue of incentives. In the global north, food safety is driven by two things: regulation and consumer pressure. And the regulations are implemented. And supermarkets are absolutely terrified of a food safety scare. I mean, they're terrified of it. So that commuter pressure puts pressure all the way along the value chain. And it's just as powerful, in fact, maybe more powerful than legislative control. But in the global south, there is regulation, there are standards, but very little capacity to implement them and adhere to them. So we have to think about other levers and other incentives, especially in the informal markets. And in ILRI, we've been working on this area for more than 10 years now. And we've demonstrated that you can put incentives in place for behavioral change in the informal market. And there are two key entry points. One is the traders themselves in those informal markets, but also the consumer. And we've found that if you can raise consumer awareness and consumer education, they begin to put pressure on the informal traders, including the milk seller who's selling milk on the doorstep. But then you have to supplement that by training those informal trainers on the very basics of food safety and food handling. It doesn't have to be high-tech, it can be very simple. And we've demonstrated in a number of countries in East Africa and in Assam and India that it does work. In Kenya, we've been working on a project in one of the counties in Kenya. The Kenya Dairy Board is very interested in the results we've achieved and is now interested in scaling that up across the rest of the country. So we can make progress in the informal market, but it needs a different approach to the approaches that are normally used in the global north and in the formal sector. Thanks.
Thank you very much. It's really actually great to hear the emphasis on the informal markets, and that you are actually finding ways of bringing in food safety perspectives there. I see your hand going up like this, and so couple of minutes for you to say something so that I can go to Aditi to give us some closing remarks based on what she's been hearing. So over to you first for your hand.
No, I just wanted to reinforce a point that Ian made at the end, and I was actually thinking of making it before Ian made it, so it's good that. But I mean, we've talked very much from a public sector perspective here, right? But the private sector has an enormous role in this area, and so I mean, I think Ian said it very well. I mean, But there it's driven by consumer demand very, very strongly. And so this comes back to the point also that Martin made in these growing urban areas and the macro cities which are developing and things like that. And so somehow we need to think of converting this demand, which is maybe latent, okay, which may not be very, but you know, even in, that's what people always said to me, you know, even in the poorest areas, I mean, parents care about the health of their children, right? It's not that there's no demand for food safety in all these places. So the issue is just how to translate that into an incentive system so that businesses have an incentive to respond for it and to take care of it, I think. And so here there is, and this is, I think, where the good systems in the world have this balance between public regulation and then the private sector introducing a whole set of regulations. I think, coming back to an example, I mean, if you look back, there was a major shift in the food safety system in Europe in around 2000. And basically, in a lot of cases, before the regulations were actually in place, the private sector had introduced all kinds of self-regulatory systems for itself. And the same thing is happening now in the sustainability area. And so I think they should be absolutely part of the solution going forward. Thank you.
Thank you very much. Aditi, I come to you now. I mean, you've heard we have challenges on the African continent, food safety. Our food systems are in transition as elsewhere, but I think given where our agriculture development is on the continent, if we can bring in these elements of One Health, food safety and others into those development plans that we have, we can actually create trajectories that are positive to meet our food security, meet our food safety needs, and also address some of these One Health issues that have come up. Aditi, your concluding remarks for us based on all the wonderful listening you've been doing?
Thank you, thank you. Good morning all. I'm Dipti from the World Bank, working in Southern and Eastern Africa, specifically on One Health. Thank you for being a part of this discussion this morning. I think it's a Friday morning after a very full week, and the fact that you are here listening is testament to the interest and the commitment that we all have in transforming food systems in ways that protect human and animal health and welfare and safeguard our environment and ecosystems. So thank you for being here. Of course, we heard a lot from the panel. It's a very rich discussion. Thank you all panelists coming in from various different angles, from as financiers, as government, research, NGOs working on the ground. So thank you for being here. And we heard about managing the many complexities in terms of minimizing trade-offs and spillovers, of maximizing co-benefits, also with other sustainable development objectives as we take on One Health approaches. And instead of summarizing the many points made today, I think I'd like to re-emphasize the pressing need for collaboration and better coordination of our One Health activities on the continent. I think in the Africa context, it's a saturated space. We have very strong technical partners, Africa CDC, we have government, as we heard today, very committed and with the right institutional frameworks in place. But I think, and of course we have those working on the ground and those that are coming in with increased financing and investments, which is still a need, but I think increasing interest there. But I think we don't often speak to each other well enough, often enough. And I just want to highlight a partnership, a very nice way in which a regional collaboration has been taking place in Southern and Eastern Africa. It's in the development of a regional One Health action plan or roadmap. And we have member states through SADC, through the regional economic bodies. We have the CGIAR, the World Bank, and other partners coming together right now in developing this regional action plan. And I would just like you to be aware of it and to share this, because we plan on bringing together partners around the table early next year to sort of, again, have a discussion, raise awareness, bring in commitments, and of course influence policy in One Health. So with that, thank you.
Thank you very much. I think that I wasn't expecting you to talk about that, but that's a nice place to end, because it gives us something to look forward to also that is actually going to actually help us. So, ladies and gentlemen, we've come to the end of our session. I had promised our panelists that I'll get them out of here by 1:45 so they can go to the next sessions where at least 2 of them are speaking. And so please, with me, let's say thank you, a round of applause to our panelists.